Welcome to the magical caldera where love and unity is our superpowers. Hello everyone. Yes, I'm talking to you. I'm talking into a dirty mirror right now. Anyway, this is myself. This is me and my glorious fatness, as you can see. But what I wanted to show you is today I'm going for my hernia surgery. And I'm not going to the same hospital because they are insane. And even the doctors that I'm going to today said the other doctors at the other hospital should not have, number one, told me to walk or exercise with a hernia this large, which I think has made it even bigger. And I will show you from the side in a minute, because it really does. It just looks like, you know, I'm very pregnant. That's what it looks like. And also, oh yeah, someone left a crappy ass comment on my video, and how I did this was I was exercising on the Tony Gazelle equipment that I had bought, and it basically just ripped open my stomach. Now that day I was on my monthly, so I really didn't realize what was going on because I was hurting. When I woke up the next day, I was white as a ghost, literally. Apparently I'd lost a lot of blood, and I didn't know I had a hernia. So I took an iron pill, and I think I rested, but it was very painful. What's even more painful is I'll show you from the side. This is my hernia. As you can see, it looks like I'm pregnant or something. This is the whole thing. This is the whole thing. So that's why I'm getting repaired today at St. Joseph's Hospital. Yay! Because what had happened was I had a cut, like my skin opened up on my hernia underneath this area, and it wasn't closing up. It still hasn't closed up. It's just a little bitty opening, but it looks like someone just ripped my skin on the outside, not on the inside, and it's already ripped on the inside as well. So I went to emergency room, and they said, well, it has to be fixed, because obviously it's getting worse. It says, don't walk, don't do this, you know, don't do anything. Try to stay still until you know, you can get into surgery. Oh yes, the crazy surgeons at Grady wanted me to lose some weight, and they are basically insane. My doctor said, you know, that's crazy to tell you to lose weight when you have a hernia like this, because you can't exercise, you know, you can't really do anything. So he says it's really catch-22 over there, and they really shouldn't tell patients that at all. And when I went to emergency room and talked to the doctor there, I ended up just really, when I told him what happened, I just ended up breaking down crying, because this has been a saga for many years, particularly with this crazy hospital, and you know, it really fucks with your head when you're neglected like that. And they neglect their patients. So I don't know what legally I can do about that. I swear to you, if I come home without a hernia belt, like they said I was gonna have to wear for 2 fucking weeks, I mean, I'm just really gonna contact a lawyer, because these people are insane. Let's see, what else did the doctor say? Oh, he did say that if I'm tired, I haven't ate or anything. Let's see. Oh yes, he did say if he had to do a large repair, which he does, that I may stay in the hospital for a day or two. I don't know if that's going to be the case, because you know, I'm pretty healthy besides being fat. You know, I have, you know, I've been skinny as a rail growing up, and then, you know, having children, I got fat. But I had pneumonia before, and I was on cortisone, so, you know, and then the hormones, boom. But regardless, I'm pretty healthy other than that, I think. Besides, you know, I have some other issues, but they're issues I've had when I was skinny, so it's not like major issues. Anyway, that's what's going on. I thought I would keep all of you updated I know some people are just complete assholes. And yes, this hernia is so big that it does affect my blood pressure. And there is, from the heart to the stomach, there is a nerve called the vagus nerve. And if it's pulled on, it can affect your heart and your blood pressure and things like that. So the one thing I did learn throughout this whole process is how to control my blood pressure with a hernia this big. And if you take 2 tablespoons of coconut oil with honey every 12 hours, it will regulate your blood sugar, not your blood sugar, but your blood pressure. And you don't have to take blood pressure pills, and your heart will work just fine. Some people, I had to take 2 tablespoons because the hernia is so big. But I'm thinking I'll be able to get off of it once it's fixed, because my heart was fine before the hernia. But I have an ex who takes 1 tablespoon twice a day for his blood pressure, and his blood pressure is back to normal and fine, so he doesn't even have to, take blood pressure pills anymore. So anyway, I just thought I would tell everyone this, and I guess I'll see you guys after surgery. Bye. Alright, hi everyone. It is now, I think, August 12th. And it's 8 months after I had my hernia surgery. You can see, I still have some fatness right here because it stretched out my skin so much. But if I turn from the side, you can just see like a little, muffin top going on. So I don't know if when I lose some weight, it's going to, go back to normal to the way my skin was, because there are horizontal stretch marks from the hernia. So honestly, I really do not know what's going to happen with that. So anyway, what I'll do is I'll tell you about my surgery and a few things you should bring to the hospital. They are like must-haves at the hospital, especially if you spend the night, because the hernia surgery I had was very, number one, it was a long surgery for hernia surgery. And number 2, the nausea was unbelievable, but there's 2 or 3 reasons for that. So anyway, let me turn you guys around and I'll sit down and tell you guys about it, okay? Alright, so the weight I am now, I probably lost a little bit of weight since I went into surgery. I went into surgery at my heaviest. So if a doctor tells you that you cannot have surgery because you are fat, he's full of shit, number 1. Number 2, be aware that they put gastric bypass people into surgery heavier than what I am now, okay? And probably heavier than what a lot of people are who have hernias the size that I had. Another thing is to remember, the other hospital I went to is just, they were completely insane, and they lied to me about so many things about my hernia surgery, okay? Number 1, they lied. They said my hernia, the hole I had in my stomach, was about this big. It wasn't. The surgeon came out of surgery and told me the hole was about this big in my abdomen. So they lied. Number 2, they can't read CAT scans at Grady. 3, and I'll tell you this after the fact, but they said I was going to have to wear a hernia belt for 2 weeks. No, I didn't have to wear a hernia belt at all after my surgery whatsoever. Oh, I cannot tell. And yes, I can sue them. Okay, I can sue the other hospital for a neglect, but just to get a lawyer to sue them would be about $5,000, and I'm not going to waste my money on that when honestly I've been blessed enough to be healed. I mean, by a very nice doctor, and by a very nice, just very generous hospital. Okay. Another thing is, if you go to a hospital and they tell you you're too fat, or they won't do the surgery and they say no, okay, and you don't have any high blood pressure or any other weird kind of funky stuff going on, go to another hospital, okay? And I would recommend going to the Catholic hospitals, because they are linked in somehow with the government, with Medicaid and all that other kind of stuff, and they can help find a way for you to pay for the surgery, because a lot of people can't pay for these surgeries. Obamacare is not helping people, did not help me whatsoever. So, ask for a second opinion, go to the Catholic hospitals. They usually start with St. Joseph, St. Mary's, whatever, some kind of saint, and go get help. They will help you. When I went to the emergency room in November, what had happened was under my hernia, on the outside of my skin, it had started to bust open. And I felt like this just kind of like cutting pain, almost like when somehow, you cut yourself with like a box cutter or something when you're trying to cut open a box, or maybe a really bad paper cut. And I lifted up my hernia and it had busted on the outside of my skin, not the inside where it was already busted, but on the outside. And I kind of freaked, and the anesthetic took me to the emergency room, and I was so upset. I mean, I was just, I was hysterical by that point. And so the emergency room doctor, who's a very old doctor, he said, Karen, and I swear to God, I just burst down crying, but he said, Karen, we will get you help. It's going to be okay. And I mean, I was just, I was crying so much. It was so bad. And he said, and I told them how the other hospital had told me to exercise and to lose weight and do all this kind of stuff. And both the emergency room doctor and my surgeon said no. He said, you do not do that ever. And they said, don't walk. And this is what the emergency room doctor said, and my surgeon when I saw him. He said, do not walk. Do not get up and do anything unless you have to. Period. No matter what it is. Because by the time I had seen the emergency room doctor and seen my surgeon, it was getting to the point where I couldn't empty the dishwasher. I could not switch over the laundry between the washer and the dryer. Okay, that's how severe this was. It was affecting my back to the point where it was getting harder and harder for me to get up out of bed. And I have back problems anyway. I've had it for years and years, since my 20s, because my arthritis is so bad. It's throughout my whole body, but it's really bad in my back. And it was putting so much pressure on my back, and just pulling my back out of whack so bad that, it was very difficult for me to get up. Sorry, I don't mean to cry. It's just, it was such a horrible journey, And then, let's see. Oh, I did see my surgeon, and my surgeon said, he said, you can get Grady to help you and this and that, blah, blah, blah. You don't have to come through here if you don't want to. And I told him what had happened with Grady, about how they said I need to lose weight and this and that, blah, blah, blah. He says, that's catch-22. You can't lose weight when you have a hernia. You can't exercise. You can't do anything. So anyway, my doctor, I think it's Ludi. I think that's how you pronounce it, Ludi. He helped me here at St. Joseph's Hospital in Atlanta. So if you need a good surgeon, general surgeon, go to Dr. Ludi. He will help you. He's a gentleman. He's older. He's probably in his 50s or so, and he didn't just come out of med school, okay? So, and he's a very nice gentleman. Okay, so the morning of the surgery, when I did the first part of this video, was on December 10th, 2014. I was not thinking straight that morning, and for God's sakes, if I was, I would have came a little bit more prepared for the surgery, I think. I know I was very tired when I made that video, and when I did get into surgery, it was, I was on night schedule anyway, so it was already time for me to go to sleep when, when I was going into surgery. So I was like, yeah, obviously, but anyway, everything's going to be cool, right? But anyway, we left here, I'd say about 10, and we got there about 10:45 at the hospital, and we did the finances and stuff like that, and they called me in about an hour later, which probably around 12 o'clock, and I went into the triage area, and oh my God, my back had pulled out a little bit, and I was trying to get unclosed, and it was a little bit difficult for me. I did it anyway, and I had this nice, wonderful Latino woman. She was going to do my IV, and excuse me, she's from New York, and she reminds me of, oh my God, I cannot say his name. He's a famous actor. His name is John Leguizamo. Oh my God, I said it! Can you believe I said it? That's the first time I said his name right. I think that's right. Oh my God. Anyway, So she was just sassy, and she's nice, and she's bubbly, and really nice. She tried to get the IV in this hand, and that bruise is not from my IV, it's from the shower next to me, shower. But anyway, shower door. And she tried to get the IV in, but I get this from my mother. My veins roll like crazy. If I'm dehydrated, if I'm upset, if I haven't eaten in hours, my veins will roll like crazy and they will not cooperate. So she was like, oh my God, your veins, you know. And so what they did was, what she did was she said, okay, now Miss Fleming, I am not going to give you anesthesia so I can get this, you know, needle in this vein and get the fluids flowing, because these veins are not cooperating. So I was like, okay, fine, I'll be okay, I can deal with it, you know, have my blood taken many times, I'll be okay, right? And so she took the smallest, can you see that? You know, like the smallest vein in this area right here. She got the needle in, right? And I was like, okay, I'm still okay. But what happened was the fluids would not flow into the vein. And she says, Miss Fleming, she says, you know, your veins don't want to work. She said that probably means that you have a valve closed in that vein. And she says, I'm going to have to hold the IV up and just let it go into your vein and push that valve open. And I was like, okay, you know, I didn't think it was going to hurt. I thought it was going to be fine. I thought I was going to be all right. So she's standing there for like 5 to 10 minutes, this poor woman, Latina woman, holding this bag of IV up, you know, and she's like trying to get it in, and all of a sudden I feel this pain in my hand, you know, and it's like so severe, and it's going through my body, and the adrenaline is just going off everywhere, and all of a sudden I get this giant head rush, and I want to scream, but I can't, and I kind of go, ah, like that, you know, and I just got dizzy so fast. And what happened was the valve had just opened up like that really quick, and it was painful. It was so painful. Don't let anyone tell you that's not painful. It is very painful. I mean, it's such a shock to the system, you know, and you just don't even realize what's going on, you know. You're not even prepared for it when it happens. It's just, it's god-awful. I mean, it's one of those things that happen, and you can't even believe the amount of pain this little bitty thing in your blood vessel is causing, you know. It's so bad. But anyway, it took me about 15, 20 minutes to calm down because I was so upset, and because I was so dizzy and just freaked out from that. And but she was very nice. Everyone was very nice to me. Everyone was very kind. Okay, no one was snappy or mean. The girls came back, and Brianna's dad brought them back, and oh my God, before we left the house, he was doing this weird Muslim prayer. I don't even know what it was. I mean, he was rocking back and forth and doing all this, you know. I was like, oh my God. I was like, thank you, but could you stop? Because it was really freaking me out. I mean, it was, you know, this is the thing about surgery. Every time I go into surgery, or every time I have something bad happen, my family members who have passed away and angels always come to protect me, and they're always there. And I know this because I had a vision one Christmas in Christmas 2008 of my relatives being at both the births of my children. So I know who's there. I know they're with me. You know, and it was such a blessing to get that gift on Christmas. It really was. So I wasn't really freaked out. I wasn't upset, you know, because I've been through many surgeries, and I was fine with it, you know. I was like, it's got to be done. I'll be okay. I'll survive. But anyway, so the girls came back in triage to give me a hug and kisses goodbye. And Lily, oh my God, Lily was hysterical. And Brianna was crying, but Lily was so much worse. She was just crying, hysterical. I mean, she was so hysterical that the doctor just, you know, left and gave her some time, you know. And I talked to her, but then, you know, she cried so much she made me cry. And I told Brianna's dad, Shabazz, I said, please go get them some food, just let them calm down. You know, just go feed them while I'm in surgery, you know. And, but anyway, and they refused to go. They refused to go eat, you know, because Mom was in surgery. But anyway, it took me a while to calm down, and the nurse was like, are you okay? Why are you crying? And she said, are you crying because she was crying? I was like, yeah. She's like, you're not worried about yourself, are you? I said, no, I'm worried about my daughter out there freaking out, crying, because, you know, Lily really, you know, Lily's never been without me. Neither really has Brianna. They've always been with me, with their mother. You know, I homeschooled them, and yeah, they're a little bit sheltered, and But Lily's got a little bit of autism, so she freaks out more so than the average person would during certain things. When she's stressed out, she kind of just, or she kind of freezes, you know, she kind of freaks out a little bit more. And this is coconut water. I know it looks nasty, but it's really good for you. So anyway, after that, they took me back to the OR, and I had my surgery. I was in there for a little over an hour, which is a long hernia surgery, because mine was a large hernia. But what happened was, when they took me back to recovery, anesthesia in general does not last a long time. I mean, unless you're pumping it in my body, it just does not last. The effects of it will last, but as far as keeping me asleep, it will not last. And I'll give you a good example of this. When I was younger, before my father passed away, I think I was 13, I had all four of my wisdom teeth cut out because they were coming in like this at the wrong way. And, I woke up during the middle of the surgery, and they were pumping me full of anesthesia, and I woke up. And I was very thin at the time, but I woke up anyway. So anesthesia doesn't necessarily work on me, right? And you can give me morphine, and it doesn't do nothing to me. I'm like, why are you giving me this shit? It doesn't work. Anyway, what happened was they'd taken me back to recovery, and I woke up right away. And a nurse came by, and she looked horrified. I mean, she looked like, she saw me awake, and her face just went white as ghost, and she looked horrified, you know. And she's like, are you okay? And I just looked at her and said, yeah, I'm fine. I'm okay. I'm fine. And she just kept staring at me like she seemed like the worst thing possible in the recovery room, right? So then she went and got the anesthesiologist. And she's a real nice lady, and she came up to me, and she's like, are you okay? You know, and I'm like, yeah, I'm okay. You know, I'm fine. And she's like, oh, well, you know, your surgery was like seeing a baby put back in. I was like, oh my fucking God, you know, just stop. I need my rest. I'm supposed to be asleep now anyway. I don't know why I'm awake, but I need my sleep. You know, I was like, oh my God. But then the worst thing is, she went and got the doctor right away, because I was awake right away. And he said, oh, everything went fine, you know, the whole unit was on like this, and you're fine, and everything's good. And he's like, and he was very nice, but they were all freaked out. So finally I was like, fuck this, I cannot deal with these people aggravate me after surgery, you know. And they were doing their job, they were really nice, but it was so weird, you know. Anyway, and there was this little Chinese lady beside me, and she was trying to find recovery, and she was looking after everybody. I think she just looked to see when the rooms were coming in, so we could be moved, you know, different people could be moved and stuff. But what had happened was, all of a sudden, I had woken up from something. I don't know. I woke up a little bit, and because it's, you know, it's hard to sleep with other people talking and stuff, and I don't sleep well anyway. I have it for years, all my life. I don't sleep well, okay? And if I do get to sleep, it's a miracle. And if I do stay asleep for a long period of time, it's really a miracle. So, she goes, oh my God. She's like, oh, that's not lipstick. And I was like, oh, what? And I was like, what do you mean it's not lipstick? What do you mean, you know? And apparently what happened was that when they took the ventilator out of me, I have bad asthma, so they put a ventilator down. And I think St. Joseph's, when they do surgery, I think it's a standard thing that they do, put the ventilators into your lungs anyway. But what had happened was when they took the ventilator out, it hit my lip, and it had busted it pretty bad. And no one had really saw it till I started bleeding everywhere. And so she took this cloth, oh my God, this rag or whatever. She cleaned out my mouth, dried off my lips, all this kind of stuff. It was awful. It's like she's cleaning out a cup or something and doing dishes. It was so bad. Oh my God. Let's see. Oh yeah, that's still recording. Okay. So then it was about 7 hours later, because I got out at about 2:05, something like that. About 7 hours later, before I went into my room upstairs, and the Chinese lady was livid. She was mad. She was fussing about everyone, and then finally I was taken upstairs, and I think it was about 7:30 or so. And so I went upstairs finally, and she got my family, and we went upstairs, and oh my God, the girls hadn't ate yet. I was like, why didn't you take them to eat? And he's like, they didn't want to go eat. I was like, oh my God, they haven't ate since this morning. I said, take them to go and eat right now. Take them, get them fed, and get them in bed. But anyway, I did try to eat after my surgery, and I could not. What had happened was they had given me a really strong pain pill that I was not used to, and it starts with a D. I don't remember it. But it's the kind that causes severe nausea, and I was already nauseated from the surgery, and I tried to eat some broth because I thought, okay, I'm okay, I can probably eat, and I was hungry, I was really starving. And what had happened was, when I ate, projectile vomited everywhere. And that happened 3 more times because of that medication. And it wasn't till later on in the night, when the lady from London came in to give me my injection for my pain because I had gotten up twice. Like, I got up around 11, so I hadn't been up for I don't know, 12, 13 hours, something like that. I had not been up to use the restroom or anything, and I was thirsty, and all I had was ginger ale, okay? I never had ginger ale in my life, ever. And they're like, the nurse is like, well, all you have is ginger ale. I'm like, oh my God. Okay, so let me tell you something about ginger ale, and a lot of, maybe you guys don't know because you guys don't know about herbs, but ginger ale, ginger in general is great. It's a drying herb, okay? It's great for weight loss because it gets the water off your body. But you can't take it constantly, okay? Because it will literally dry your body out, make you dehydrated. So she gave me ginger ale to drink, and what I would recommend, do not, if you're sick to your stomach like that, ginger is good for a sick stomach, yes, but not constantly when you've had surgery and you're dehydrated. It's not good for that. What you need to do, and these are like the 4 things you need to do for if you have severe nausea, surgery like I had, where you have severe nausea or anything like that. And you can do this, if you are sick or anything like that, for that matter. Number 1, if you're in a hospital and they say, oh my God, all you have is ginger ale, get whoever you're with, that's your family, to go to the vending machine and get out about 3 Sprites, okay? Sprite does not dehydrate you. Yes, it's a carbonated drink, and I don't drink sodas very often, but if you're nauseous, it will work. It will settle your stomach down without dehydrating you. Ginger ale, if you drink too much of it, dehydrates your body so bad, Ginger is only good in little amounts for your body, not huge amounts, okay? And number 2, have your family bring bananas with you, to your surgery. That way, when they say you can eat bananas. Bananas will calm your stomach down immediately and help you help you settle down, okay? Help your stomach settle down, the nausea go away. You'll be able to eat. Number 3, bring peppermint gum. Oh my God. Anytime anybody's sick or anything, if they feel like they're going to throw up, get them peppermint gum right away. Peppermint calms stomach, stops the nausea. Or if you have mint tea or anything like that, give it to them. It will stop it. And number 4 is aloe. Now, you can get aloe glow, and it's in white grape, and you can drink that. It is a clear liquid, and you can drink it, because they'll tell you can only drink clear liquids until you've had a bowel movement at the hospital. And that's fine, because it is a clear liquid. Or the best aloe I've ever had is Herbalife aloe concentrate, the mango, and it comes in like a big bottle like this, and it has to be refrigerated. But what you can do is, if you have to go to the hospital, put some in a little bottle or something and take it with you. It's not going to go bad. It's antibacterial, antifungal, anti-everything, and it will calm your stomach like that in a flash. So those are the things you need to bring with you. The gum, I did have gum in my purse, and it did help me to not vomit as much, but I did throw up 3 more times, 3 times in one night because of the medicine. And what had happened was, when the anesthesia wore off, and the lady, it was about 2 o'clock in the morning, I got up one more time to use the restroom, and I thought it was okay. And all of a sudden, just all this pain starts hitting me, and it's about a 9. Now, I've had levels of 10 before in my life, and 10 is bad, but I've had above 10 before. And like this year with a tooth situation. But anyway, the lady came in, she gave me my painkillers through my IV, but as soon as she did, I could feel the nausea set in as soon as it hit my veins, because the anesthesia had worn off, and I could tell what was going on in my body then. And I said, this is making me sick, this is making me throw up, and she's like, well, I'll give you nausea medicine, but she gave it to me after the fact. So, and I could not keep down water either because I was throwing up. So, the ginger ale, plus the medication, plus the surgery caused, a bad situation with my stomach and throwing up. Now, everybody knows when you go into surgery, you have a catheter. And because I was laying down for so long and didn't have enough water and things like that, I ended up with bad urinary tract infections that lasted a good 6 months on and off, but then I started passing kidney stones. So, if there's any way you can get that Sprite in or water to keep from getting dehydrated, do it. Because, I was in so much severe pain for so long with these infections. I went back and forth into the hospital and things like that for a long period of time. The doctor came and saw me in the morning and said I could leave. He checked my incision, everything was fine. But I threw it one more time and they brought me my breakfast, but my banana wasn't there. And I got really pissed because I knew if I could just get this banana down, I would be okay. But they brought me like eggs and coffee and whatever else. I don't know what else was on there. I could not tell you. Probably Jell-O, and I hate Jell-O. Jell-O is disgusting. It's like snot. It's just disgusting. And I don't like regular coffee. I like organic coffee, and I'm very picky about coffee or tea, whichever one I drink. So I tried to drink some more water before I ate my eggs. Water before I ate my eggs, but the water came up. It projectile vomited all over the bed. So what I had to do was I just drug everything off the bed, tried to eat the eggs, and I did get them down. But I was still pissed because my banana wasn't there. I was like, where the fuck is this banana? Anyway. And also, if you're prone to urinary tract infections like I am, or bladder infections, which I've been all my life, please bring cranberry pills with you. When the doctor says you can eat, take them. They're not going to hurt you, but they'll clear out all that crap out of your urinary tract infection. And I did bring cranberry pills with me, like a few, but it just. I guess what between the different drugs and ginger ale and stuff like that, and not getting enough water down for so long, because the next day I didn't drink enough water either. I think it just caused havoc on my system. But you can take cranberry pills. So anyway, after I got the eggs down, they told me I was discharged. So I managed to get everything on me except my shirt, because I had an IV. So I went to the nurse and said, I need help taking out this IV. I've been discharged. And she looked like so scared of me, like I was going to kill her. And they were on the desk was a banana and the ginger ale, and she slowly pushed, the banana towards me like, this woman is going to fucking kill me. And I probably would have, because I was pissed. I was pissed by that point, and I was upset. I was so I was just irritated, and the medicine they gave me just, it just made me crazy for a long time. Anyway, so Shabazz and the girls came and picked me up, and they got me in a wheelchair and took me downstairs, and Shabazz and the nurse helped me into the truck. And I thought I did okay getting in the truck. I thought I was okay. And she got me some extra gum, and I was trying to chew it on the way home, so I wouldn't throw up. And, but by the time we got home, which it was only like a 30-minute drive, probably less than that, probably like 20 minutes, because I don't live that far from St. Joseph's. But we got home, and I thought, okay, well, if I can just turn myself, to the side, I can get out easier, right, of my truck. And, I have an Expedition. And, I couldn't do it. I could not do it, and I almost just started crying. And Shabazz came around and he said, don't move. He said, just don't move. And he literally, now Shabazz is a big man. He's a lot bigger than me, and he's a lot taller than me. But he picked me up out of that truck and walked me in. Him and the girls helped me walk in. And the girls set me down. So, but the girls took care of me. They brought me my herbs. I ate more bananas, which helped. I took aloe, which helped. But after being home, maybe for a couple of hours, I started literally pass out in my office chair. I was watching TV and I started passing out. So the girls helped me get into bed, helped me get my herbs, and I don't remember exactly what I ate. All I remember is I ate 2 more bananas when I got home. That's all I remember, really. Anna said, you know, Mama, if you need to get up and you need help, here's the chair. It's going to be right here, and you're going to be okay. She says, if me and Lily don't hear you, here's the chair. So I said, okay. And so I slept from probably 12 in the afternoon till 6 o'clock in the morning the next day. Now, when I came home, my whole body ached so bad from sleeping on a Tempur-Pedic mattress that they have at the hospitals. I was in pain. I mean, I was in so much pain. So what I did was I took 2 turmeric pills, which I never have to do. I mean, one will knock out the pain, but I was in horrific pain. And I remember getting up around 6, and I think I got 2 more turmeric pills because I was just in so much pain. My whole body ached. I mean, it hurt something so severe. But by the next morning, I could not move at all. I was just locked in my bed, couldn't move. And the girls had woke up and everything, and they said, Mom, you okay? I was like, no, go get Shabazz. Like, now, go get him. I cannot get up. And what happened was one of my legs had locked up pretty good, and it hurt to move. And it was my right leg, and I couldn't move it. And my back was hurting. Everything was hurting, you know. So, Shabazz came and he moved me over, and he picked me up off the bed again, you know. And by that time, I was just in tears, and I was crying. I really wanted to take the hardcore medicine again, even though it was going to make me throw up because that's how much pain I was in. But I managed to get through it. I changed the dressing twice a day. I still got kind of an infection there, and I think that was partly from the urinary tract infection going on in my body, so it just kind of added to things. So when I was on antibiotics, it started clearing up and all that kind of stuff. So the incision, though, when I came home, was about a good 6 inches long. Now it's shrunk to about 4 inches. So, but now you can barely see it. But I don't really scar a lot. I don't scar really heavily or anything like that. Now, for the first 3 weeks, probably, I had a very hard time eating. I could only get down 1 meal a day, solid meal. After that, I just had to start making protein drinks because my stomach could not handle it, and it would hurt so bad. After 3 weeks, I got down 2 solid meals per day, and then I drank either juice or a protein shake. And then after about a month and a half, I was back to normal, eating 3 meals a day if I wanted to. Another thing that was, and the nausea lasted about a good month and a half from it. Because, you know, when your intestines have been outside your body for so long, they're not used to functioning properly. And then when they put them back, you know, they have to learn how to kind of work again normally, and, you know, all that kind of stuff. So it was a long, you know, it was a very long recovery. Let me see. Another thing that happened was, it was about 3 or 4 days after my surgery, and I thought I would be okay just to lay on my side. So, you know, if you guys don't know this, if you ever had torso surgery or anything like that, what you can do is you can take a pillow under wherever you had the surgery and put it under your stomach or wherever the incision is, and it will help support. And this doesn't matter if you're skinny or fat, because gravity pulls on incisions. It doesn't matter. Gravity doesn't care if you're skinny or fat. It's like, oh, you know, it's gravity. Anyway, if you will put a pillow under there, it will help support it. Or if you know, you have to sit up, just put a lot of pillows behind you. You know, if you have to rest, put a lot of pillows behind you so you can get up. Anyway, I was on my side, and I put a pillow under me, and I thought, okay, it's going to be okay. I can sleep on my side now, because I thought my intestines had settled down. Oh, hell no. I woke up, and I got up, and all of a sudden, all my intestines just started moving. and I grabbed onto the mattress so hard, and I wanted to scream bloody murder, but I couldn't, and I just, you know, it was one of those things, one of those unexpected, painful things that happen that you just, I think your mind doesn't even know how to process it, you know? You know, it's like you want to scream, you want to cry, but you can't. Another side effect is after all the medications I had from my surgery, for a good month and a half, I was crying a lot, on and off, crying like hysterically, like getting very upset very easily, crying a lot, to the point where my daughter Lillian would say, "Mama, you have to calm down, you have to calm down," you know, and thank God for St. John's wort, or I don't know what I would have done. I detoxed a lot of the crap out of my system, but it's kind of hard to detox when you have to take antibiotics because of an infection. So it was, you know, it's like you either take this and get better and then, you know, detox or whatever. So it was one of those situations. And then, you know, another thing that happened that was pretty bad is a couple days after my surgery, I did take a bath, and I did fall, and I fell on this arm, and it got all bruised, but I didn't hurt myself or anything. I didn't hurt an incision or anything like that. You know, they say you can lift stuff after a week after a surgery like that, but no, you can't. That's nonsense, and it's on the paperwork, but it's nonsense. Let me think. Is there anything else? Oh, there is one other thing that happened that really freaked me out. I thought I had disposable stitches, and I did. But there was one that wasn't disposable, and I saw it poking out of my skin. I was like, "What the hell is that?" And it was a stitch, and I ended up pulling it out, you know, with some tweezers. That freaked me out, and I hadn't went back to my general surgeon because I had been in the hospital on and off with urinary tract infections so much, and I had already let another doctor look at my incision to see if it was okay. So that's why I didn't go back to him. Not that he's not a good surgeon or anything, he really is. And I guess that's about it. The only other thing is, about 3 months, I still had some nerve endings reattaching. And for anyone who's had surgery, you know, they know how that feels. About 3 months, you hit like, you know, with a freight train, and all of a sudden you have all this pain going through you, and boom, it's gone just like that. I've had some things happen like that, and I had them happen like 2 months, at 2 months. And a few of them were pretty severe, that it lasted longer than just a few seconds, where I was holding on to my stomach and literally just crying and just hoping it would stop, and I would have to take a pain pill. So that was about 2 months afterwards, but it was an on and off thing. So I didn't really stay constantly on medication. I'd say I only stayed constantly on medication about a week. And then I just took it as needed. So, you know, but it was a slow process to heal. So anyway, that's about all for this video. I know it's a very long video, but there's not many surgeries where people have large hernias like this, where they know where they've been through it and they've had to deal with it. I hope if any of you do have a hernia like I had, if a hospital refuses you and gives you a bunch of nonsense, please go to another hospital and get help, okay? And don't accept no. Just keep, you know, do what you have to do to get help, okay? Because there is a hospital out there that's going to help you. And, you know, don't give up. I know it's very hard, and I think it's wrong that they don't do hernia surgeries or other surgeries like they're supposed to, when they're so willing to take a fat person and put them on the table for gastric bypass like that without a problem. You know, and they don't understand. And the hernia I have, when you have a hernia like that, your food is not processed normally, number one. Hard to use the bathroom sometimes. And if you have allergies, it's made worse because then you have the leaky gut syndrome happening. And I did. I ended up with allergies, severe allergies all over my face, in different parts of my body. and it was severe. So if you're not digesting your food properly, how the hell are you going to heal properly? So there's good doctors and bad doctors out there, but the doctors really need to use their brains, because digestion is where healing starts in the body, really. So anyway, and any holistic person will tell you that. Then you can look it up on the internet if you want. Anyway, I love you all. Hope you're all doing well. This is the bathroom in my house. That's my messy closet. I'm sorry I didn't clean my bathroom, but I'm not in the mood. I'll do it later. Anyway, love you all. Blessings to you all. And I hope all of you, no matter where you are doing well. And if you're not healthy, continue to work on it. Continue to ask for help. That's the biggest thing. Now I just have to lose all my extra fluffiness, which girls really hate when I tend to lose weight. Because I'll lose weight and then I'll stop, and then, it's a struggle. But they really dislike it, because all of them know me as the fluffy mama that I am. So anyway, love, light, and blessings to you all. Bye.